Hi guys, hope everyone is keeping safe. I would like to start by thanking all of you, our countrymen, different countries who are coming forward to help us. Our government, everyone is contributing to this fight against this pandemic. And as responsible citizens of this country, I strongly urge all of you to please follow this rule. Please stay home, please stay safe. So today we are here with yet another video, and I think this is a very important video for all of us. We are trying to talk about what are the uses of physiotherapy, or what can we do with exercise point of view in COVID. And to talk about this, we have our dear friend and colleague, Dr. Aisha Sheikh. Dr. Aisha did her bachelor's in physiotherapy from Mumbai. She's a gold medalist cardiorespy physiotherapist. She did her master's in cardiorespy physiotherapy. She's a consultant cardiorespiratory and critical care physiotherapist at Criticare Center. She's a certified ACLS provider. She also has different certifications in kinesiotaping, dry needling, pharmacovigilance, over 5.5 years of experience in this field, and she has done many research and has published it in various international and national journals. So Nupur and I would like to welcome you, Dr. Aisha, on today's topic, and I would like you to please take over from here and help as much as people as we can today.
Thank you so much for that beautiful introduction, Asmita and Nupur, both of you all. And thank you for having me. So I will try my best, and through this video, we are going to help a lot of people, reach a lot of people in terms of improving their vital capacity and being healthy and fitter in terms of their lung health.
Correct.
So we'll start now.
Yes, Aisha, you can just share your screen so that
you
can see the presentation. I hope you guys find this helpful.
Before I start, I would just want everybody to know, whoever is watching this video, that chest physiotherapy is a very important and a supervised kind of for patients. It is usually and preferred when it is done when it is supervised by a physiotherapist or a respiratory therapist or a cardiac therapist. It should not be done without supervision. This video is going to just help you to give an overview how you can improve your lung vital capacity. But I would recommend you consult a chest physiotherapist or a physiotherapist before starting these exercises. So let's start. First of all, we would like to thank all our frontliners who are really working very hard in this difficult time. In turn, we should also be doing the same by staying home, staying safe.
As we are going through this pandemic for more than 1 year now, we all are very well aware how does COVID-19 spread and what are the common signs and symptoms, what to do when somebody tests positive in our house. Now we learn how to wear a mask. You cover your nose, your face and your chin, avoid any air leaks, prevent touching your face regularly. Further, I will be discussing about breathing exercises and dyspnea relieving postures which are proven to be very helpful. So as you can see in the patient can sit and lean forward on a pillow to relax. In the second picture, you can see a patient leaning forward and placing some weight on the hands to relieve dyspnea. Whenever a patient's normal breathing pattern is interrupted, shortness of breath can occur. You have to ask the person to sit in a forward bent posture. It stimulates your diaphragmatic breathing. The viscera drops forward and the diaphragm descends more easily. The patient can gain control of his breathing and reduce the respiratory rate by performing Pursley Breathing, which we will be discussing in detail as follows. Have the patient stay in this position and continue to breathe in a slow and controlled manner until the episode of dyspnea subsides.
So what is proning? It is a simple technique that requires patients to lie on their belly with the chest down, the chest and the face down. Flipping a patient in prone position helps respiration by improving the oxygen supply in the blood. This has been used very frequently and commonly in COVID patients and has given very good results in terms of improving your oxygenation. Now there are a few other positions which also help to relieve and improve your oxygenation. So the first one is you lie on your belly. The second one is lie on the left side. Then you turn to the right side. Then you can sit up as if with a little support under your back with a little inclination. And the next one is you go back to the belly flat position. So these positions are recommended to be done under the supervision of a physiotherapist or a chest physiotherapist.
Let's go on to talking about pursed lip breathing. It is a strategy that involves lightly pursing the lips together during a controlled exhalation. It particularly is used to relieve dyspnea. It is thought to keep the airways open by creating a back pressure in the airways. The benefits are it decreases the respiratory rate and the work of breathing, that is the oxygen consumption, and increases your tidal volume and improves your exercise tolerance. Now you have to sit in a comfortable and a relaxed position, following which you take a deep breath from your nose slowly and deep through your nose and breathe out gently through slightly pursing or pouting your lips as if blowing on and bending the flame of a candle but not blowing it out. The expiration has to be very relaxed and the contraction of abdominal muscles should be avoided.
Exercises to improve your lateral costal breathing, the lateral side of the lungs, because most of the time, because of COVID, because of body ache, malaise, fever, you are not going around, you are just lying down straight. So you need to improve the oxygenation in the lateral and the posterior part of the lungs, which is very important. So this is another exercise which helps you to do the same. You take a towel around your lower part of your ribs. You take a deep breath from your nose and you blow out from your mouth as in the earlier exercise. While blowing out from your mouth, you just pull the edges of the towel in the opposite direction, giving it a downward stretch. So when you do this, you facilitate your next breath and improve your expansion. The other position for your posterior expansion is keep both your hands with assistance on the back lower side of your scapula, or you can say the lower part of your you can keep it in the lower part of your scapula. That will be better to explain exactly. And you try to expand that area while taking a deep breath. So by doing that, you understand that that part expands when you take a deep breath and goes down when you blow out. The next thing is for your upper part of your lung, which is called the apical expansion. With your own hands, you can keep it on the upper part near your collarbone and you try to expand. So as you can see, the lady in the first picture is sitting with both her hands clamped and down. So while taking both her hands up, she takes a deep breath in the nose and slowly while getting her the hands down, you blow out from your mouth. This is the first one. The second one is you keep both your hands behind your head. You just rest your hand. There is no pressure. So once you take a deep breath from your nose, you're expanding your thoracic cage. You turn to the right side and then you blow out. The similar you do for the left side. Why do we do these breathing exercises? The most important thing is there's improved respiratory function. The gas exchange, which I mentioned, the ventilation, perfusion, diffusion improves. It increases your lung volumes. Your vital capacity improves. You improve the chest expansion. It promotes relaxation and reduces the reliance on oxygen if applicable. Now we go to this very good instrument, which is very commonly used and many of us have seen this nowadays. So this is called the incentive spirometer. There are 2-3 types available in the market. You can use any of them, which will be prescribed by your physiotherapist or your respiratory physiotherapist or your medical practitioner. Accordingly, it has to be used. This is basically used to strengthen and improve your respiratory muscle functions. So as you can see, there is a mouthpiece. You put the mouthpiece inside your mouth. You lock it. There should be no air leaks. Following which, you take a deep breath from your mouth inside and you see the balls going up. So what are the after effects of coronavirus? There is malaise and generalized weakness. There is long-standing dry cough. A lot of people have oxygen dependence, secondary to the variable degree of lung fibrosis. Patients may also develop distress secondary to prolonged hospitalization, social withdrawal, and social stigma. There is loss of smell and taste. Chest pain and headache are less common. What are the management? Most important is you have to have an adequate nutrition and hydration. Chest physiotherapy and incentive spirometry play an important role in your recovery, also pre and post-COVID. Patients with long hospital stay may require nutritional build-up after discharge. Patient may also require counseling, family and social support to overcome the stigma. Another important exercise which you can do is your calf exercise to prevent thrombosis. For example, if a patient has been admitted to an hospital due to the COVID, there will be a physiotherapist who will be guiding him through the entire protocol regarding him, and it is curated each and every day depending on the patient's condition. So if you are a person who is at home, who is safe, you should start with breathing exercises. You should improve your lung vital capacity. You should give a good thoracic expansion to your lungs so that in future you try and get a good and a healthy lung in terms of your vital capacity. If you are a post-COVID patient, it is advised to continue with your chest physiotherapy under the supervision of your physiotherapist for better and good results and outcomes. The last thing is, how do you prevent it? You have to wash your hands regularly, use a soap or a sanitizer, avoid going out, please stay home until unless it's very necessary or important. Wear a mask covering your nose, your mouth and your chin. Avoid handshakes. Use a disinfectant. Please stay home, stay safe. Thank you.
Thank you so much, Dr. Aisha. You have given us such an important information. I think it's going to benefit a lot of people who are going to watch this information because this is the need of the hour. And whatever exercises you have prescribed, they're so crisp and clear. I think, but the main thing is before you start with any exercises or any whatever recommendations were given, I please request the patients and the people who are watching our video, please consult your physiotherapist, respiratory therapist, your doctor before you begin with anything, because the exercises protocol vary according to the patient condition. So yes, it is very necessary you consult a physio before that. But I request everyone, stay home, stay safe. And yes, Asmita, if you want to say some last words.
I think Nupur covered everything, and the whole idea of V3 doing this was to help people. But as mentioned by Dr. Aisha and Dr. Nupur, it's very important to please consult a doctor. Please do that before you do any exercise. And thank you once again, Aisha, for doing this for us. I hope everyone is safe. And please take care.
Thank you so much.
Thank you.
Hi, guys.